Welcome to Standards Michigan's teleconference. We will be discussing our collaboration with the University of Texas Medical Branch in the development of standards in which they are engaged. Today on our call we have Mike Anthony with the University of Michigan and Lee Webster, University of Texas Medical Branch. I will now be turning the call over to Mike.
Thanks, Christine, and thanks, Lee, for calling in to give us this quick update. So this is what we're going to have Lee talk to us about. We're trying to do two documents in one, and actually it may well be, and you can see on the screen here, these are the project numbers we've had for these, and I'm going to say that I'm going to mention here that there's going to be an emergent ISO healthcare administration, and I think Lee will give us an update on that administration standard. I'm embarrassing myself with all my typing problems here. So anyway, these are the two main projects, and then Lee maybe will talk to a bit about this. So what you've seen here. Back in March, this is the last time we really touched this project, although Lee and I met, what was it, over Christmas? I think it was over Christmas. You and I had met, and so we talked a bit about this, and we put we threw our support when this was announced publicly. We told our community that there was a standard solution, an emerging standard solution, and that we would let at least our followers understand that. So that's where we were back in March. So that's the last time we touched this. Now we did touch on another one, and the reason we're doing both of these is that Lee is actually directly employed by the University of Texas Medical Branch, and he has some history with this particular document. Notice on this map that the Secretariat is actually the United States, and I believe that used to be the Society of Human Resource Management, where Lee was a leader for some years, and they are now taking it from a level, the national standard, ANSI standard, and then becoming the Global Secretariat on Human Resource Management. So to summarize then, before we cut over to Lee and to Lee's screen, these are what we'll be dealing with, and I think, presumably, we'll be talking about this one mainly, and then we'll talk about this one as a follow-on. So, Lee, are you ready for me to cut over to your screen?
Yes, please.
Okay, great. Maybe you should say a little something about yourself too, Lee, while we do all this, huh?
Sure. Hello, everyone. My name is Lee Webster. I am currently the Director of Talent Acquisition for the University of Texas Medical Branch in Galveston, Texas. Prior to that, I was the Director of Standards Development for the Society for Human Resource Management in Alexandria, Virginia. And that's how I got involved in the standards work. So since 2008, I have been involved in creating the American National Standard Setting approach to creating human resource management standards. And most recently here at UTMB, I've been involved in also establishing a new standards, an area of technical inquiry, I should say, in the development of standards in healthcare administration. I'm going to approach both of them in turn as I move forward with my presentation. So let me start with healthcare standards. And I hope you have on your screen a slide that talks about a Dr. Tom Boat. Before I go into that, let me just say very quickly, what are we trying to accomplish with healthcare standards? You can envision a structure where UTMB, University of Texas Medical Branch, has a Standards Development Institute. We're calling it a Healthcare Standards Institute, although it covers HR as well. Underneath that institute, what we are establishing is an area where standards will be developed both domestically and internationally for healthcare administration, and then a pillar for developing international standards in human resources. And we also imagine that there will be some cross-pollination between the two, because much of the standards that are developed in healthcare administration also include those that deal with labor and employment. So we expect a liaison relationship to occur there. In this structure, as it is right now, we are the secretariat or secretary of the domestic standards development effort for healthcare administration. And as you'll see in my presentation, soon we will submit a proposal to create a new technical committee at the ISO level, of which the United States will be the secretary, but effectively we will, or secretariat, but we will be doing the real logistical work for healthcare administration across the globe. We are also the administrator of the U.S. tag for the HR standards work. So if you're looking in that column, and what that means is we oversee the body of U.S. experts that provides feedback to ISO as they develop, or the technical committee at ISO as they develop international standards. So for those of us who are familiar with standards, you get what I'm talking about. For those of us who are novices or just entering this, a lot to swallow. So take it in small bites. And in fact, let me move to a small bite right now. So under healthcare standards, as you can see on the slide, Dr. Tom Boat, one of the things that's very important in developing standards, and particularly domestic standards, is identifying leadership that has credibility in the technical space that you're working in, so that you can begin to assemble a group of colleagues or a group of interested parties in your committee, in your development committee. And Dr. Tom Boat has recently agreed to be the chair of the U.S. standard setting body for healthcare administration. He is an accomplished professor and leader in the area of pediatrics. His information, if you want to press his link, is there. We are very, very happy to see that he is interested in doing this, and this will allow us now to take the next step, which is to begin to assemble the actual committee that will be developing standards, which we expect to start sometime in the next month or so. Later this month, our top organization, the University of Texas headquarters organization, will be reviewing this idea to create a healthcare administration institute, and we are very confident we've produced the argument, the point of view that they will accept and establish this new institute. And with that, we will move even more aggressively in developing these standards. As I said before, our interest is to create an ISO technical committee for healthcare administration. I've talked to representatives from the various national standards bodies across the globe, mostly in Western Europe, but some in Asia and Africa, and in all cases, without an exception, all of them think this approach of creating standards in healthcare administration is the thing to do, and they would immediately join it if it existed. So really the only limitation is getting this proposal up through ANSI to ISO. We anticipate once that is done, it will be approved. What is the benefit to you and to organizations in having this healthcare administration standards exist? Our view is, and our research shows, is that 65 to 85% of the cost of healthcare deals with the administration of it, from admitting patients to the HR stuff to the supply chain to you name it. And frankly, behind the curtain, all of that is chaotic and all of that is unique without adding value. And if we can figure out a way where we can create effective approaches to managing the back office of healthcare, we believe we can lower the cost of healthcare, or at least reduce the rate of increase. By doing so, we create more access to people, which is one of the things we've all said we want. By creating more, and also the research exists from the UK as well as within the United States that shows the better managed the back office of healthcare is, the higher patient satisfaction is, and the lower patient morbidity is. So what that means is the better you run your HR, your finance, your supply chain, your operations, not the clinical side, that's important too, but the better you run these functions which have been ignored, the better outcomes you'll have both financially and patient care. That's why we're doing this. I hope to meet with, and in fact I've begun the process of setting up a meeting with the new CEO of the American Hospital Association. We hope to convince them that this is something they might want to get involved in. And the CHRO for UTMB has gone to a major conference with other CHROs about other subjects, and he brought up this healthcare administration standards idea. They seem very interested. So we're not only confident that we'll get international support from this, will get support from healthcare providers throughout the United States. Next slide. So this slide is more operational in nature. It's just talking about what we're working on to try to further the work. So example, we're working on marketing and communications tools so that we can make sure we inform people about this so that people can join. We recognize we need to have a unique, independent website, perhaps attached to UTMB's website, but certainly exclusive enough so that people can go to it and learn more about what's going on. So we're working on that. Again, as I said, we're working on healthcare standards effort to actually start our first committee and have them pursue the first project sometime in late September, early October, or at least recruit then, and then have a meeting in November. And then we expect the international community, if everything goes well, to approve this. And so we anticipate the first plenary for the healthcare standards meeting will occur sometime in either the spring or the fall. And once we get the approval, we'll know more about that. So that's healthcare standards. The update for the HR standards, and the next slide, is much more productive, but it's been around longer. The HR standards, there has a standard for the subject of human governance, which deals with boards of directors more aware and engaged in workforce decisions or workforce activities in an organization. It's a standard that was voted, that was created by the French, was voted, and it's passed DIS status and is proceeding to FDIS status, which means it's just one status shy of being published. We anticipate that document will be published later in the fall, early winter. There is a standard for recruitment that has also been voted out of DIS status, and we see it proceeding to FDIS, and we expect that one also to come out toward the end of the year. The country of Germany has submitted a new workout proposal for creating what they call internally and externally reportable HR metrics. The summary I use, the way I call it, is investor metrics, a way to inform the investor community in a credible way of how you are managing your workforces within your organization. They've now submitted that new workout proposal, and the U.S. TAG has approved the project, and I believe all the other countries have as well, so I think that one's moving forward. The U.S. TAG member has also submitted a proposal to the TAG to create a new workout proposal for global diversity and inclusion standard. We expect that to be a very high-quality product, and I would be surprised if it didn't move forward, not only out of the TAG, but also in the international community. As I said, Dr. Ron McKinley, who works at UTMB as the CHRO for the UTMB, is also the current chair of the U.S. TAG for Human Resource Management. He is undergoing an election, but he's the only candidate, so we anticipate he will be elected as chair again for another 2-year term. And then finally, the next plenary for ISO TC 260 will occur here in the United States in Galveston, Texas in November, and that should be 2015, in November 2015. Our plans for the following plenary will be in Singapore, and that will be probably in November 2016. That's my update for now. I'm open to any questions. I'm going to hand the floor back to Mike.
Thanks, Lee. Let's go over to the ISO. I'm going to become presenter again, if you don't mind, and let's noodle around with that ISO 260 website. So those who are not familiar with the relationships among the different nations, we can give a little bit of a bird's eye view, an astronaut's view, I suppose, of what it looks like. So I'm going to make myself the presenter again, and we're going to hie ourselves over to the ISO website. Let's get to ISO 260. Actually, I think I've got the link right here, don't I?
Yeah.
Right here. Oh, this is the work statement. Is this actually the site itself, the interactive site? Feels that way. Okay, so here's that plan. No, that's not what I really wanted. I wanted to get a map. Where's that map here?
Yeah, there it is.
U.S. Secretariat, both the ISO Secretariat and the U.S. Let's see. I may have to go because here we go. There we go. So this is the This doesn't give us the map, though, the nice interactive map that I like so much. So let's just go to ISO 260 on our browser. ISO 260, it was a 260, ISO 260.
Yep.
And it should get us here. And we should get a nice map. We should see a map. Where's our map? Usually it's right around in here.
Yeah, it's...
There we go. Okay. All right. So here we have the large number of participating countries. It looks like South America's not there. Any thoughts as you look at this map, Lee, knowing what you know about the global reach of this? Any thoughts on who's in and who's out and why not?
Yeah, one of the challenges we've had ever since the creation of this new technical committee is encouraging South and Central American countries to get involved. We've reached out actively to the national standards bodies and as well some of the businesses and large manufacturers in those countries to say, this is something we think interests you, you should be involved, we encourage you to do so. And we haven't received much engagement, lots of discussions, but not any decision to join. Not sure why. We are still continuing to do that. We think maybe once we have a standard produced and these countries see that there's actually work occurring and that the work has value to it, we might then begin to kind of crack the code on that. But as you see there, we don't really have any countries in South America involved. And there's also another issue that tends to emerge when the human resources, unlike other areas where there's a very large financial infrastructure, there's sales of products and the like. In human resources, there isn't. So there's not a lot of money floating around to send somebody to a conference or to a meeting about human resources standards. So what you often find are countries that are developing, they really don't have the resources to participate in this standards effort. So we're working with ISO to figure out, and ISO has some particular ways they can help fund people from developing countries to participate. One of the things we're also thinking about with the healthcare administration standards is maybe doing something called twinning, which is the process of not just one country overseeing the development of the standards or being the secretariat, but having two countries effectively co-lead an area of inquiry. And typically when twinning is applied, ISO would like you to make your twin to be a developing country. So again, I think part of it is them not seeing any utility, which maybe a standard will provide. Part of it is simply the cost, which we will pursue ways to help alleviate the expense. And then finally, part of it is getting a fellow developing country involved in the work so that other developing countries see that they have skin in the game. We hope by approaching it from those three levels, we might be able to get more involvement from these countries.
Yeah, that's a nice way of tiptoeing around a rather sensitive issue. Right, it's fairly clear from this map that the developed economies are the ones that are most engaged, and the developing economies, the ones that are likely to be delivering labor value-add activity or economic activity, are the ones that are not in this right now. Also, human resource management is a softer science, so to say, so I get that. ISO has some very lovely acronyms for these emerging economies, and I'm at a loss for remembering them. But you've summarized that rather well, and I wasn't aware of the twinning, though. That is an interesting concept. But I know that these emerging economies, it's of interest to Christine, for example, who's researching the degree to which other nations directly support their standards bodies. In fact, since you're close to us, you might offer some insight into that, because that might offer some insight into this map. So when we ask the question, Lee, ANSI is a public-private partnership within the United States, and it's supported largely by member fees, just like any other 501c3. In other countries like Standards Norway, Standards Australia, Standards India, the member bodies to the ISO are supported by their government. Do you have any insight on the differences in how standards activities are supported by different governments?
Well, you're right. It varies almost as frequently as the number of countries that could be involved. So we've encountered countries that don't provide any private industry representation to any of our meetings. They all are government officials because that's how they develop standards. It's through the government. While the United States, as you said, is more of a potpourri. Anybody, including government, could be involved in these standards developing efforts. And then some are all purely private industry driven. Another way to look at it is also structurally. BSI, which is the standard setting body for the UK, they work for the Crown. They don't work for a kind of quasi-public-private interest. So they are quite nimble and quite focused on working on projects that will have a value, that will return value because they work for the Crown. Meanwhile, you can talk to another group and they have a totally different experience. So part of the other issue with working with these developing countries is simply lack of an awareness of how standards will lift up their practices. We firmly believe, particularly in the healthcare, but also in human resources, the incremental gain in a developing country or the marginal gain in the developing country in their economies is much greater because many of the standards we will produce will be some that in developed countries they either already meet and in some cases exceed. While in developing countries where practices are more basic, these standards are what I call a poor man's consultancy. So a developing country can look at it, follow these practices, and elevate their gain and gain more value by following these standards than by ignoring them or not participating in them at all. So it's a very complex experience when you're dealing with a lot of these countries, particularly in what you described as softer standards areas. It's easy to point at a light switch or to point at, I don't know, any other kind of tangible material standard, some manufacturing standard. And I know it's not easy, but you can point at it and come to some kind of resolution or understanding much more quickly than you can about practices. Because when you deal with practices, you can't help but then deal with the cultural differences of those who follow their own practices. And when you try to standardize that, many countries feel like you are ignoring or suppressing the unique cultural natures of their countries. So the move from A to Z is not a direct path, and again, if we can get more countries from these developing countries to participate, we can be more confident that when standards are produced, there'll be something that these developing countries can and will use.
I like your metaphor A to Z. How many characters does the Chinese alphabet have?
Yeah. Yeah, that's a good example. I use that metaphor, but that metaphor would not apply in Japan, would not apply in China, and as you notice, Japan's involved, but China is not. In fact, the interesting thing for me in China is the Chinese news service was the very first organization that picked up the very first press release on the standards work. I know for a fact that the folks in China are very interested in this work, but they've decided not to get involved directly. Now, some of it's internal Chinese issues between ministries, but part of it, I believe, is they're just watching to see what happens to decide, is this legitimate and for real or just some busy work? So as I've communicated to the folks who are in charge of the new projects, the ISO projects in the HR space, and as the current chair has communicated to me as well, it is very important our first few standards send a strong message that this is for real, these add value, and we want people or organizations to use them.
So there's competition among various Chinese ministries? Not possible.
Yeah, I didn't know that. You might have been very familiar with that, but there's apparently a standard-setting ministry and a human resources ministry among many, and they haven't decided who should represent China on something like this.
So, Tristine, why don't you weigh in a little bit here? You've done a little bit of, at this point, a light research on the Chinese. And remember, before we get too much into the politics here, we just had a teleconference on collaboration and competition. So I want my Chinese colleagues to know that we're sensitive to the fact that to some degree on some projects we have to we have to collaborate. We all can't afford an atom smasher. On the other hand, some selective strategic competition actually grows markets. So with that much said, your thoughts on on the research you've done on the Chinese story, Christine, would be helpful here.
Right, absolutely. It's wonderful that we've actually circled around to the Chinese, because we have been recently discussing how they actually dominate on technical committees with the ISO. So they have well over 700 memberships on technical committees. We're in the 616 range. So we've actually been looking at the priority that China gives to their standards organization and standards development. So among the other things that we've observed recently is that they also are very committed to standards education. They have standards education programs at over 30 universities currently, and maybe more than that. That was as of 2007. So we know that standards development is an extremely high priority for China, and so I did notice right off the bat that they were not a member on this committee. And I found that interesting, and I wasn't sure why, and so thank you, Lee, for sharing that with us, because one would suggest that they would like to have membership on maybe all of the committees that exist, because it does seem that their leadership is prioritizing standards development to a greater degree than perhaps we are able to in the United States. And so we can look to them and say, well, why do they do that? Why is it of such great value? And we can answer those questions. It probably would take more time than what we have today. But nonetheless, it's very interesting the reasons that you have presented, Lee, as to why they may not be right at the starting gate on this particular committee.
Mm-hmm.
But one other thing I'd like to add, Mike, is that it's been a very interesting ride with the human resource standards overall. My friends, and I consider my friends at the International Labor Organization, originally weren't very supportive of this, and in fact communicated across the globe that the development of ISO standards in HR management would be a problem for them. And it took direct engagement by me talking to the person at the International Organization of Employers, which is a subgroup under the ILO, and explaining to him what we were trying to accomplish and also how it could facilitate some of the goals that he had for the ILO to change their mind and then to join the technical committee as a liaison. So particularly in this area of human resources, although not exclusive to it, as you know and Christine know, a lot of this is engaging people face-to-face or person-to-person and having a discussion. And once you've had that discussion, it's not foolproof, but I find you don't get anywhere unless you at least make the attempt.
Yeah, a couple reasons. I want to refresh my colleagues' understanding of why I picked this out of the hundreds, really thousands of ISO standards. One is that largely our industry, the education industry, if you just put the education facilities industry apart from this, we've been engaged on some standards that involve biotechnology and lighting, but we want our intellectual property to go overseas, and we want some overseas intellectual property to come over here. And as you said earlier, I'm not sure if you said it in this or our preparation discussion, Lee, but we're trying to transfer competencies. You know, we have these global value chains where we're moving products, and as a product goes from country to country, value is added to it. But what's happening in the economies now, especially in this emergent Internet of Everything zeitgeist that we seem to be approaching or in the middle of, that moving these competencies back and forth, professors, the kind of research or the kind of teaching that they convey to their students or into their field of expertise, this is also a large part. It's not just the fact that you can weld, two pieces of metal together and move it farther down the line. We're moving ideas across. We're moving ideas across the globe, and the human research. So that's why we try to be very, very clear that we're in the idea business. There really is no substitute. This is the fundamental currency, at least of what we do here. And our idea, so our engagement in this is because we know that the education industry, at least the academic side, is a very outward-looking industry, and but The business side is not so much. They still are bound by local rule regarding products, labor, and also finally that from a construction standpoint, one of our rules of thumb is that for every dollar of material, you're actually putting $2 to $3 of labor into it. It could be skilled labor, unskilled labor. It could be but as I tried to say, it could be the labor added by a lecturer, for example, versus a Nobel laureate professor that Lee recruited for the University of Texas. So
Right.
that's all I want to say about it. I want to just remind my colleagues that we're not doing this. We have thousands of ISO standards to be involved with. This one strikes me, since it's being actually, we do have an obligation to our other universities, and University of Texas's leadership in this area I thought was one that ought to be applauded and supported to the degree that we can. Again, we're doing this to give our constituency, so to say, an update, because this is our obligation. We feel, every day, we're getting to the point where we're doing them 3 or 4 times a day now. We'll be doing them hourly because that's how fast this moves. That's why we refer to what we do here as streaming advocacy. We talk about the era of e-government and streaming regulatory action. Well, we are at least for the user interest, the streaming advocacy capability for what amounts to about 8% of the U.S. economy. So let's see. So to go back to our statements, I think so. Just to give some structure to this update, and really it ought to be a conversation, a conversation with Lee Webster, conversation with is it S. Lee Webster?
Lee S Webster, yes.
Lee S Webster. I see. Okay, so that's what we'll probably title this YouTube clip, and we'll be up there within an hour or so. And I think we've covered it well enough. As much as we can't do this too much of this because our audio visual guy will complain about the length of the recording.
Okay.
We'll turn over a 25 megabyte file and he'll come back with a quarter terabyte file. It gets to be pretty difficult. So to summarize, if we go back to our site, what our colleagues have just seen here and what we will see is an update UTMB. I'm getting better at that, aren't I? This will be the same person as the mastermind between these two standards, and this ANSI standard, and then also this one here. You mentioned this has been around for a while, Lee. How long? How old is this document here?
ISO approved the creation of the technical committee in February of 2011.
Okay, so it's been around, but in the standard space, maybe not around so much. It's important for us to get early on. I make this point often to our colleagues, is that the standard of care is usually set. The benchmarks is usually set in the first drafts of document. It is true that a lot of these documents end up being very dilutive, but the people who write these end up meeting again in 5 years, 3 to 5 years, for example, and that's where a lot of the stuff happens, because what you often get is a very large document. And when a large document occurs, you also winnow the ability of other competing interests to review it because it's just so big. So it's important to be in on the document in its original conception or original creation.
I agree. I can't agree more.
So I guess, Christine, anything to add to this before we close? I'm going to give you the closing privileges today. How about that?
Oh, very good. I have no additional comments. I just wanted to thank Lee for joining us today to discuss these standards and their University of Texas medical branch's engagement in them. Very important work, and we're looking forward to working with you on these as it proceeds. Thank you, Lee.
If it's on now, I'll just say that on behalf of the University of Texas Medical Branch, we truly appreciate University of Michigan's support and interest in this work, and I personally appreciate both you, Mike, you, Christine, and Rich's support and engagement in the development of these standards, and we look forward to future opportunities to talk about this work.